Chances are you've seen an e-cigarette or vaping device before. These products, which contain nicotine, are made for adults who are looking to move away from traditional cigarettes and have been proven effective at helping adults quit smoking. In fact, e-cigarettes are 2 to 3 times more effective at helping adults quit smoking than the Food and Drug Administration's approved medicines, and don't come with many of the downsides of traditional cigarettes. No tar, no carcinogens, and no smell. The sale of all tobacco products, including vaping products and e-cigarettes to kids and those under 21, is already banned across the country. But the industry continues to implement important product marketing and social media restrictions to limit youth exposure to vaping products and keep them out of the hands of kids. This means no marketing on major social media platforms like TikTok or Instagram, and saying no to the use of influencers and younger-looking models to directly market e-cigarettes and vapes. Thankfully, youth use, which peaked in 2019, has plummeted 50% for high schoolers and 70% for middle schoolers, even as the availability of vaping products, and particularly flavored vaping products, has grown. The FDA was given the power to regulate e-cigarettes. Since then, it has outlawed almost all vaping products, with one major exception: products owned by Big Tobacco. Of the millions of currently available vaping products in the U.S., the FDA has chosen to authorize just 8. That's right, 8. A couple of which are either so old or unpopular that retailers don't even bother trying to sell them. Furthermore, the FDA has banned every flavored e-cigarette from the market, despite the fact that the science overwhelmingly demonstrates that flavors are essential to helping adults reduce smoking or quit altogether. At the same time, the FDA has authorized 900 new cigarettes. Fewer vaping options will only hurt adult consumers, and there appears to be no rhyme or reason for why certain products are granted FDA authorization and others aren't. Instead of empowering consumers with a wide variety of less harmful vaping options, products millions of Americans have been relying on for years to stay away from cigarettes, the FDA is selectively using its power to pick and choose winners and losers, not based on science, but based on fear of reprisal from some of the most powerful special interests. The real losers, of course, are millions of everyday Americans struggling to overcome an addiction, those whom the FDA repeatedly instruct to just quit on their own, while at the same time flooding the market with hundreds of new cigarettes. This is a clear form of regulatory negligence from the FDA, which has chosen to ban as many vaping products as possible, even though their mission is to end smoking. But it's no surprise. The FDA's regulatory approach to vaping products in the U.S. continues to be arbitrary and incoherent. The handful of products that the FDA has authorized are not substantially different from the many of those it has not authorized, creating a confusing and opaque marketplace for manufacturers, distributors, retailers, and most importantly, consumers. The FDA must stop playing favorites. The need for regulatory consistency and clarity based on science is critical, and the FDA thus far has demonstrated an inability to provide it. In fact, the FDA's own scientists told an independent review group in 2022 that their scientific decisions were being overridden by senior officials who wanted a different, politically motivated outcome. The longer the FDA refuses to authorize less harmful nicotine alternatives, the longer millions of Americans will continue to suffer from smoking-related disease and death. Ironically, these actions further disadvantage minority, low-income, and LGBTQ populations who smoke cigarettes at disproportionately higher rates, the communities which the FDA claims they want to protect. When it comes to vaping, Washington must create a regulatory environment that works for all stakeholders, keep children safe, and preserves access to effective public health and harm reduction tools for adults looking to quit smoking. The FDA needs to use its authority to promote the smoking cessation and harm reduction benefits of vaping. Until then, it must ensure that any regulations are based in science, not politics. But until that happens, Americans should understand that when it comes to e-cigarettes, the FDA isn't looking out for their interests. It's simply blowing smoke. For more information, visit the Vapor Technology Association at vaportechnology.org.